Hi, this is Dr. Ed Aleo. I wanted to talk to you today about comorbidity. You've heard recently on the news that term with regard to the coronavirus. Well, comorbidity also occurs with hearing loss. And as we age, we often have other simultaneous presence of chronic disease. And remember that hearing loss itself is a chronic progressive problem. Once you have it, it gets worse. It doesn't usually get better. In saying that, when we talk about comorbidity, oftentimes the people who have other problems like depression, anxiety, isolation with hearing loss have more difficulties in adjusting and understanding. They also, other problems that this group may have, which is our group that we see mostly, is they have kidney disease, cancer, memory loss, heart disease, stroke, mental health problems, and sensory impairment. To that end, when we look at hearing loss, we look at what happens. Oftentimes we think of hearing loss in isolation of all the other comorbidity situations, and that's not true. So as we age and as we have difficulty with hearing, it also has difficulty with processing or cognitive processing. With that, I mean that what you hear is faulty, and as a result, what's sent to your auditory cortex in your brain is also faulty. And so we have misinterpretation of what's said to us. To give you an example, real quick, we often think of hearing loss as just being the ear. Well, it's more than the ear. The ear is only the beginning of the analysis of what's being sent to your ear. Once it leaves your ear, it goes to your brain. And the process going to your brain, let's just take one spot. The first place out of your ear is called the cochlear nuclei. Nice term. Well, what this term does, what this first phase does, is it looks at timing. It's a temporal thing. So what happens is if you don't hear well and you have a high-pitched hearing loss, at this first juncture, you have a timing problem. So people with hearing loss miss the first parts of words, or they miss the end of sentences, and as a result, they end up chasing the conversation. I'm sure if you have hearing loss, you've experienced this. The result is that they withdraw from the conversation, they become more isolated, they don't go out, they don't go to restaurants, and they just sit there and don't respond. So I guess the bottom line is that if you have any difficulty with hearing, please call our office, go to our website, which is ClearSoundHearingNY.com, and schedule an appointment to see one of our doctors, and they will either do a online consultation with you, or you can schedule to come in. Have a good day, take care of yourself, and be careful. Thank you.